started. The webinar agenda has two parts and each will take 20 minutes. The first part will list down the top 7 mobility healthcare solutions and opportunities and challenges in mHealth. In the second half, we will discuss about the whole 9 yards on what it takes to go to mobile in terms of the mobile strategy and roadmap for healthcare organizations. We will have Q&A session during the last 15 minutes. You can type in all your questions anytime the GoToMeeting question panel. I will forward your questions to the panelists and it will be addressed during the Q&A session. In the speaker's profile, I'd be glad to introduce our speakers to you. Our first speaker, Finny, is the Healthcare Practice Manager and the Subject Matter Expert at Aspire Systems. He has more than 9 years of experience in the field of healthcare. Over these years, he has worked in various capacities as a hospital administrator, a business consultant, and a functional expert. Our second speaker, Vinod, is the Mobile Practice Manager at Aspire Systems. He has more than 14 years of experience in the mobile space and consulted several Fortune 500 organizations and helped them defining their mobile roadmap. Just a quick snapshot about Aspire Systems. We have been in the software services space for more than 15 years now, and we have the global presence including the locations like India, US, Europe, and Middle East. And these are some of the accolades we have acquired over a period of time. Now I would like to request Finny to take forward the webinar. Finny?
Thank you, Arun. Okay, moving from web health to mHealth, and why do you need to transition? From this 30 minutes of webinar, what would be your takeaway is to learn how mHealth is going to benefit patients and physicians, how ISVs can extend their existing web apps to mobile apps. Then I'm going to discuss the 7 prominent types of mobile health application based on the traction which we have felt in the market and the research which we've done. What are the various opportunities and drivers? And then I'm going to leave it to Vinod to discuss the whole 9 yards from technology perspective. Okay, before I get into the crux of the 7 apps and why you need to move, I want to give you an idea as to how mobile health has evolved over a period of time. Initially, if you see, there were SMS-based alerts and notifications which were used by physicians and patients. They were basically alerts and just notifications, and then came about the education and general awareness with the help of contents which were available over the web. So these used web browsers to access information. People started using web browsers to access information. Then you had medical reference and dictionary services, clinical calculators, drug references gained prominence. Then came the iPhones and the app stores and various app stores which cropped up, where applications were used for managing disease management, lifestyle tracking tools came into existence. Then general diagnosis, question-based answers, and based on the answers, you had diagnosis done. And then you have the integrated EHR, and when I speak about integrated EHR, I'm not talking about the complete electronic health record, electronic medical record. I also include small modules like prescribing module or radiology image viewing modules. So they came into existence, and then finally the device integration, where since home healthcare gained popularity and gained prominence, device integration with glucometers, pulse oximeters with mobiles came into existence. So this is, in a sense, how mobile health has evolved over a period of time. Research to Guidance did a research analysis on global mHealth developer survey, and one of the questions which they asked their respondents was, what device offers the best business opportunity for mHealth as of now and in 5 years' time? And in 2010, when this question was asked, most of them felt smartphone was the best device, which, with the business opportunity for mHealth, and 78% of them had chosen this, followed by cell phone and tablets. But over a period of time, as we all understand, tablets started gaining prominence, and that's exactly what you see here in 2015, where it says 82% of the participants have said smartphone. They still stuck with smartphone as the best device, and 69% of them said tablets are the best device for business opportunities for mHealth. Then you see the mobile specific devices, medical specific devices, which again was propelled because of mobile integration, which could capture and which could track disease patterns and various other patterns. The other research which I want to bring to your notice tonight is, this morning, is a research done by Manhattan Research, where it basically brings about the percentage of US adults of age 18 and more using smartphones. What you see is from 2009, the usage of smartphones grew from 20% to 38%. And subsequently, what you also see is the consumers using mobile for healthcare has grown from less than 10% to 26%. And what I want to bring about from this slide is this trend is going to go upwards, and more people are going to start using mobile to access their health or for any of their health related issues. Now what I will do is I will take you through the 7 prominent mHealth applications. These 7 prominent we arrived at the 7 prominent healthcare applications, as I said earlier, from the traction which we felt in the market. And also we had done some research on what are the various applications in mobile health which gained a lot of momentum in the near future. And these are the 7 which we came across. The first one is real-time patient analysis. Traditionally, physicians and nurses in central nursing units within an ICU accessed patient information, had continuous access to patient monitoring systems, especially patients in the ICU who had to be monitored continuously. And then came the web health, where patient information was available to the doctors in his consultation room. But now with the emergence of mobile health, this information is available through the mobile and over the mobile and can be accessed by the physician from remote locations as well. This, on top of data entry ability or ability to capture information, has played a vital role in multiple industries. One such industry is clinical trials industry, where phase 3 clinical trials happen, where the nurse is required to visit patients and to record the drug interactions or the general prognosis of the disease for which the clinical trial is happening. And a lot of information gets recorded in the field. So this particular application could play a vital role in clinical trials as well. So what are the various benefits? Ability for the physician to attend more patients. The physician knows which patient is critical, which patient is not, and he can spend more time accordingly. Timely availability of information for treatment. Increased efficiency of treatment. Proper alerts and escalations will reduce reaction time. Any deviations from the normal condition, any deviations in the input-output or in the blood pressure could be escalated to specific physicians for them to take action. So those kind of interactions could take place. The next application is the mobile prescription and tracking. As we all know, mobile prescription has taken a lot of importance in the recent years, where physicians can prescribe drugs over the mobile phones. But what we are talking here is about mobile prescription and tracking, where the patients can view their prescriptions. The traditional reminder functionality of the phone can enable the drug intake, can enable the users to, the patients to take drugs at the right time by giving them reminders, and can also monitor the drug intake pattern. And the notification also ensures that refills are made on time. The physician can set, the patient can set a reorder level. So as and when the drug reaches the reorder level, the automatic refills can be sent, or even in case automatic refills are prohibited for a particular drug, then refills, at least reminders can be sent that the refills have to be sent to the pharmacy. So the benefits are increased revenue for pharmacy, increased compliance, the patient takes drugs on time, loyalty, constant tracking, improved safety of prescribing process, reduced cost through improved efficiency. The next application is connected scheduling. Of late, mobile appointments have taken up a vital role. Applications like Practice Fusion have come in and they enable appointments for a particular physician through mobile. But what we are talking here is a little more broader than that, something called connected scheduling, where physicians can connect with their own community of physicians, patients can connect with their own community of patients who have a similar condition, who have a similar disease pattern, and the physician can view the complete list of schedule for him for a particular day, and in case he needs to reschedule, or in case he wants to reschedule all the patients under him, if he cancels it, if he cancels a particular day schedule, the patients would get an alert and would also get a suggestion where the patients can choose, or the system will display, the mobile will display a suitable suggested physician in the specific geography, in the specific time, in the specific discipline of specialty. And also the physicians, they can connect with the patients can connect with one another, share feedbacks, give opinions on the physician which they view, and this could mean that the patients get to see a better physician for a better condition and get treated for the right condition. The benefits are flexible scheduling. As I said, this application could facilitate rescheduling in a more seamless manner. Community scheduling, as in the patients can view who the other patients are visiting and what kind of treatment is being provided and things like that. So community scheduling can be encouraged. Reaching the right physician at right time. Improved physician communication. And improved physician communication would mean that my personal health record can be integrated with the appointment system or the connected scheduling system. And as and when I take an appointment, or as and when I schedule an appointment with a physician, I give a consent for the physician to view my personal health record as well. So in that way it interacts, or it increases the interaction between the physician and the patient. Overburdened hospital systems, increase in chronic diseases has given way to a new business altogether, or a new way of healthcare delivery, which is a home healthcare delivery, where the patients are required to stay at home and monitor. The monitoring could be, visiting patients or visiting physician at regular intervals, or performing tests over a period of time and sending the tests to the nurses, who in fact get back to them with a changed dose in the medication. And personal health management applications play a very important role here. It could be timely geospecific information, like for example, if an asthmatic patient gets enrolled into a asthma disease management application in his phone, the phone interacts with the weather software which is already available on the phone. and any drop the weather application foresees in the next 2 weeks or in the next 2, 3, in the future for that matter, any drop in climate weather, the asthma application can interact or integrate with the climate application and could warn the users, stating to take any precautionary measure which is required. This again, enables continuous monitoring. Any trends which are seen can be synced with the hospital information system. That means less hospital visits. The patient does not have to go to the hospital every time he thinks he's got a problem. I mean, only when the nurses say, hey, your trend doesn't look good, you need to come to the hospital, he can actually go in. And then it increases social awareness as well. That means that there are applications like applications to watch your calories, applications which watches your eating patterns. You can actually enroll into this application with a little more of social interaction, where you can also watch what kind of a exercise regime your friend does. Maybe you can go along for a walk with him, because your application will interact with your friend's exercise regime application as well. The other one is image analytics. Radiology information system or radiology images are being viewed in the mobile applications, and we are talking about a little more complex tools, where we can use tools like annotation, measure distance, intensity values, display regions of interest from the radiology images itself, and also you use standard tools such as zoom, pan, etc. to view the radiology images. And the benefits which we can draw are quick response and turnaround time, use of traditional functionality of the phones like touchscreen to perform tasks like zoom in, zoom out. Incorporated tools enable first level of analysis. I am sure that what a radiology system does cannot be completely replicated into a mobile phone, but nevertheless, the first level of analysis can be done from a mobile phone. And remote peer consultation, in case the doctor needs second opinion, he can always send the radiology image to a peer doctor for him to give the second opinion. In this case, in this way, it improves peer communication and better quality of treatment as well. The next application which we want to talk about is mobile EHR. I mean, you must be knowing a lot of mobile EHR which are already available. But what we felt was bedside mobile EHRs are very useful, especially when the doctor goes for rounds, and availability of the right kind of information for the patients on a mobile EHR is vital for the treatment. And ambulance devices as well, where a tablet can be fit into an ambulance. So when the ambulance goes to pick up a patient, the crew in the ambulance, the doctor, the nurses who travel in the ambulance knows exactly what kind of a patient who is already registered in the hospital is he. In case of a road traffic accident, when the doctor goes to pick up a patient, he knows what this patient is allergic to, what kind of a medication he's already been on, and things like that. So that's very vital. So mobile EHR enables point of care access to information, increase preparedness for care delivery, increase communications with the patients, enable out-of-office monitoring as well. Of course, mobile EHR can be used for multiple purposes like viewing the prescription, viewing the radiology images, results, documents. The last of the 7 prominent applications which we want to present to you is the charge capture system. Predominantly, in hospitals, one of the challenges which they've always faced is capturing the charge for the treatment which is given. And this is because the doctor delivers the treatment, fails to capture the charge, comes back later and captures the charge, captures the treatment which is provided, or it could be because of the sheer manual intervention which is required for capturing the charge, or it could also mean that procedures which were done are not completely captured. So there is a revenue loss for the hospital as well. So bedside charge capture would increase the accuracy of the treatment provided and the cost as well. What are the benefits? It improves billing efficiency, supports both online and offline charge capture. It supports, it necessarily need not be wired all the time. You could capture the treatment provided and with the exact codes and then later sync it. Tightens the reimbursement cycle by removing manual steps if integrated with hospital billing software. Why do you have to transform from WebHealth to mHealth? These are the various benefits which we want to put forward before you. But I just want to speak about 3 benefits which I strongly think would be the drivers for you to transform. One is potential reach and differentiation. If you are an ISV provider, software provider, vendor, the differentiation when you have an extended mobile application is enormous compared to what your competitors can provide, compared to what is already available in the market. The second one which I want to talk is about improved interaction between patients and doctors. It improves the relationship, it improves the interaction. The doctors have your information in his fingertips and he can access your information all the time. It improves the treatment efficiency, it improves the outcomes of the treatments. So that's the second benefit which I want to put forward. And the last, but not the least, is access to service and treatment in home and in remote location. The doctors and the nurses can access your information anywhere they want to, and this does not limit them to accessing information from a hospital ecosystem alone. It is beyond the hospital ecosystem. So these are the 3 important benefits, important drivers I want to highlight for you to transform from WebHealth to mHealth. So what I will do is in the next session, in the next few slides, Vinod will take you through the whole 9 yards of technology. And before that, there is a poll which I would like you to take.
We'll kind of give about 20 to 30 seconds for you guys to take the poll here, and then Varun will announce the poll results.
The poll results are like this. 47% of them said they are in the early stages of the mobile app roadmap, and 26% of them said evaluating the mobile app, and 16% of them said already having a mobile app, and 11% said they are not into the mobile space.
Okay. Thanks a lot.
Yeah, thanks a lot for those who helped in filling this quick poll, and I'm now closing this.
Okay. So hey everybody, this is Vinod here. Thanks a lot for coming over to this webinar today. And from the results, it's apparent that about 75% are still don't have the mobile app, or still kind of evaluating, which is the majority group here. And thanks, Vinny, for those wonderful 7 prominent mobile application, and of course my favorite being connected schedule and the integrated prescription refill, which automatically kind of gives you notification ahead of time when you need to refill. So thanks a lot for that. And now I'll exactly show you what it takes to go mobile, and I'll cover all the 9 yards here. So when you're out of this webinar, you know what are the next steps you need to take to go mobile. I'm sure that some of you would have already related yourself to the apps which Finny just showcased, and the next question which you would be having in your mind is, how do you go about it from here? And now that you know what app probably you want to go for. So I will try to cover 4 major things here. First is the mobile roadmap. How do you actually build your mobile roadmap? Second is, what is the difference between the native and the web app? Which route should you take? The third is the usability aspect of the mobile, which is, of course, by far the biggest or significant factor when you're building the mobile application. And the fourth is the device management aspect, which will talk a lot about security aspects of your mobile application, of the data which is visible on the mobile or on the tablet, especially the data related to patients. So these are the 4 areas I'm going to cover. And to start with, how should I go about it, right? So you would start essentially with a discovery phase, where you have to define the objective of why you want to go mobile, or why you want to specifically build a mobile app, and what are the benefits attached to it. And once you kind of know that, you have to see who's your target audience going to be. Is it going to be patients? Is it going to be physicians? Is it going to be hospital administration, or is it a combination of these users? You need to determine that, and once you have that, what you need to figure out is what is going to be your return on investment for these apps. The ROI is kind of the tricky part here. I mean, it's kind of difficult always to attach number, but then if you look at it, the efficiency you would gain out of making the information available in the palm of the physician. You have to probably convert that, quantify that into a number, and what it means to have patient information on the bedside, what it means to actually capture the billing, which is the charge capture, and the accuracy of that. So you have to convert all of that into a number, and then essentially compare with your cost of investment to get your ROI. There are a lot of tangible and intangible benefits, so you will have to basically plot all of them and then come out with a number to get the ROI. And of course, when you are building a mobile app, one of the key components is analyzing your existing system. The mobile application is no more a standalone app. I mean, if you go back 7-8 years down the line, you had those standalone applications on the PDAs, especially Palm OS, where we had the reference directories and all those content from the publishers and integrated calculators but those were the standalone apps. Today, most of the apps you look for is kind of like integrated with the existing system. So you need to analyze your existing system, and from my experience, whatever mobile applications for healthcare industry, for retail industry, or any other industry I've built, having a service-oriented architecture is by far one of the important prerequisites, I would say. We have had in the past prospects and customers who already have a service-oriented architecture, so the services are just enabled and made secure to be accessed on the mobile phone. And there are scenarios where ISVs have practice management software, billing software, radiology software, kind of like on a client server model. So if they have a practice management software installed about it, 100 different client locations, and they want to actually build a mobile application, you probably have to work around the different solution. Maybe have a centralized service manager which would cater to all the requests which is coming from a different mobile. It would find out which particular hospital the request is coming from, and then it would dynamically choose the appropriate server. So you definitely need to spend some time on the existing system to make the services available. And the next one is which mobile platform should you be targeting, right? Should you target the iPhone? Should you target the Android, or do you want to target multiple platforms? So that is something you have to decide based on your user base. Maybe you can take a quick survey of your current user base to figure out where is the maximum platform getting used. And there are other scenarios where you would like to give access in no more than say 3 or 4 different platforms. There you would probably build an HTML5 application, then try to build a native application. So those are the different things which will come as part of the discovery phase, and you could probably do this in a couple of days. And the next one is the feature triaging, right? Which is essentially figuring out what features are going to best work for your mobile, right? One of the things you have to be very, very clear is that you're not building a miniature version of your existing application on mobile. Mobile can do certain things which a PC cannot do it, like the location-based services. And other device level features. So you have to think of your features more related to the fact that which are the features which are maximum use, which are the features which can take advantage of mobility, which are the features which will give the maximum value for your investment, which are the features which will add convenience to the physician, which will add convenience to the patients. So those are the features you probably want to take, and make sure that you don't don't take too many of them, because one of the important things you have to have is the simplicity of the application, and that means that you kind of don't have too many features at the start. And of course, trying to determine what is the high-level markups. It will be great if you can actually go to the whiteboard and sketch your markups and see how they would look like. And once you have that, you do a technical feasibility, right? If there are features like, example, your mobile prescription refill, right, which actually uses a camera to take a snap of the barcode which is there on the prescription bottle and then kind of decodes it. So if you're building your application in-house and you're not sure whether that feature is going to work flawlessly, you probably want to do a small technical feasibility on that one by doing a study. And then you have to determine between web and the native, which I'll walk you through in little detail after the slide, and use of the framework, right? How do you go about it? Should you use like PhoneGap? Should you use jQuery Mobile? Should you use the native environment or SDKs to actually build your application? So those are some of the things you need to figure it out, and then come up with a platform recommendation. And once all of this is done, you essentially have your mobile roadmap, and of course you have to budget for each of the application. So in case you want to actually build your app for 4 different platforms, you have to come up with the timelines for it and the budget and plot the graph, your schedule graph accordingly. A lot of time what we do is even after going through this particular exercise to get an organizational internal buying. So if you're a large ISV and you have a lot of stakeholders whom you want to get the approval, or you want to probably give your app to a focus group, which can be a set of physicians, which can be a set of say patients or hospital administrative. You want to probably do a proof of concept, right? You choose few features, 4 to 5 features. You come up with screenshots for them, how they would look like, and then you kind of build a couple of features out of them on the mobile phone. Create a provisional build, put it on the doctor's mobile phone, and the patients and the nurses, whomsoever your target users are, and get feedbacks from them in terms of how it's working. So it depends how you want to go. So if you want to get a lot of pre-feedback kind of thing, you would actually go for a proof of concept. So that's on the roadmap on how you should go about your next steps. Now getting into the nuances and some of the challenges you would have while doing this activity. So I want to talk about the native app versus the web app. I mean, if you were to ask me this question, what is the difference between native app versus web app, say 12 months back or 16 months back, I would say that the native app was by far the winner. I mean, the web app was nowhere in the picture. I mean, native apps can do things which web app cannot. I mean, there was device level features like GPS. You have your cameras integrated. You have your file system access, which means you can store data offline and stuff like that. So there was a huge gap between the native app and what the web app was. But this gap is kind of narrowing down day by day because of the fact that HTML5 has come into picture, right? HTML5 essentially can help you do things what you can do on the native just on your browser, right? So the gap is kind of narrowing every day. Still, I would say native app has its edge, but it's not far away when the web app would actually stand kind of at par with the native apps. And some of the factors you could actually see to differentiate between native app and the web app is the user experience. I mean, the kind of controls you would have on the native app, like your iPad pop-ups, your date pickers on your iPhone, your sliders, your list views, and all of that. This gives a complete different look and feel of your application, and these are inbuilt components which the users are now, hundreds and thousands of users are now totally familiar in terms of how they work. I'm not saying that you cannot achieve that. I mean, with HTML5, with CSS3 coming in, a lot of this can be emulated in the same way as you could do on the native app, right? But this has been one of the big reasons why native app has been successful so far. That is the user experience. And if you want to go with a native app and you're probably building a utility application which you want to sell it on the store and stuff like that, you may want to actually, you will have to share revenue with the App Store, may not with the Android. So that's one factor you want to consider. The ROI in the perspective of the cost here is a little different, right? The native app, if you're trying to build for 4 different platforms, is definitely going to cost you much more than building it on HTML5, which would still give you accessibility on different platforms, but with a lower cost, right? So that in that perspective, it's a little different. Go to market, of course, it depends on again on how many platforms you want to target. If you want to target just say iPad, vis-a-vis just kind of building an HTML5 application, I mean the difference is not much. But if you're planning to kind of go for 4 different platforms, Android, BlackBerry, Windows Phone, and iPhone, and then you're comparing that with an HTML5 application, definitely your HTML5 is going to go to the market much before. In the perspective of assuming all four you want to take it in parallel, or even if you take it one by one depending on the platform, the overall roadmap is going to be much longer in terms of schedule. Discoverability is basically ability of the users to find your app. Again, I mean, it's kind of difficult to say where the discoverability is better, but if you're an ISV and if you have say about 100 to 500 users you want to actually install the app, you might think whether you really want to go to the App Store at all. You can still build a provisional build and send it out directly to the users. But if you have a large user base, it's better to go to the App Store. And by virtue, I mean, the App Store has been so popular, and there are hundreds and thousands of apps that the user today invariably gets to the App Store to search for anything. Not discounting the fact that the web search is also equally working well. Device level features, as we talked about, these are some of them which are very integrated with a native application in comparison to HTML5. Though HTML5 is kind of catching up, there are compatibility issues. There may be one feature on your browser, like say offline content. HTML5 now supports offline content, but that doesn't necessarily mean that it's going to be available on all the web browsers, right? This is a site, mobilehtml5.org. You can go there and actually figure out what are the browsers on the mobile side and what are the features they support. So if you're building specific features, you can search for that and see if those features are supported on the platform which you are planning to release. If not, you will have to look for workarounds. And in terms of development environment, here are the different things. If you're going for native, all four are different technologies, different development environments. So essentially, you have to rebuild the app, except for the fact that you don't have to redo the requirements and probably some of the mockups, right? But the coding has to be rewritten depending on the platform here. So that's on the native versus web app. And here are some quick questions which can help you determine which way you should go. Think about the target audience. Is it going to be patients, hospital administrative staff, or it's going to be mass consumers? If you're planning to have a utility app which tracks your exercise practices and stuff. So think about those things, and the larger the audience, the number of platforms you want to support is one definitely a big factor here. So if you want to support 5-6 different platforms, you could rather go with a mobile web. But if you are planning to actually use device integration like with glucometers and stuff, those would actually work better with a native application than on the web application. So the factors to consider is platform, how integrated your app is going to be, how integrated your mobile is going to be with other devices, and what are the device level features you want to use. So if you can answer these questions, you definitely will get your answer. Which way to go, whether to native or to mobile web apps. The next thing I want to talk about is the usability. From my past experience on mobility, what I've seen is this is by far the biggest area where the development team and the business stakeholders spend majority of the time, right? I mean, I would say about 30 to 40% of the time just goes on the usability, coming with mock-ups, coming with various options, and the important thing is the workflow, right? How do you actually bring the simplest form of workflow into the mobility? I mean, interesting thing is that the mobile, by virtue, just forces you to think so hard on the mobility that you will actually come up with the simplest path, simplest navigation to actually achieve a particular use case, right? And that's where you have to spend your initial time in the project. and there's going to be a lot of back and forth coming in, and to actually finalize this. And you want to really build a site or a native app. You want to make sure that it's very, very user friendly. The second thing you want to focus is the user interface, how clean, how simple it is, and and making sure that you don't have too many features into the mobile application, and how can you actually build graphics which are very, very delightful on the screen for the users. This is one of the app which is again for the physicians to look at the patient information, demographics of the patient, the medications, the vitals, and the lab reports. And as you can see, the simplicity of that, it just bifurcates the information very, very easily. So you can actually focus on the area you want to capture the info. And the second, and this is another example of how you can build simple applications on iPad. These are the graphs which are there at the bottom, which can really help you choose the options you want to. And the other thing I would recommend is the exploit the usage pattern both on the Android and the iPhone platform and the BlackBerry platform. The users have cultivated a habit of how certain things work, right? For example, on the iPhone, if you swipe it on your left, a record gets deleted and you see the record button. Exploit the usage pattern. Do not try to go against that, because that sometimes the users don't like the particular pattern change, right? And the learning curve just gets wider. And these is another example of batches. You see 1, 17, and 16 on the screen. These are the ways you can actually notify the user about any notification, cancellation of appointment from physicians, or any other info which you want to get. Workflow, which we already talked about, make sure the workflow is very simple and you do not have multiple ways of finishing a single use case. Try to provide a single workflow for a use case so that the repeatability or the retention of that workflow in the user's memory is quite easy. The UI for different platforms, do not try to build an iPhone app and then make that stretched across in an iPad. You essentially have to build a different application more from a UI perspective to take advantage of the real estate there. The UI consistency, just make sure that if you mean certain things in one screen, it means the same on the other, which will help avoid confusing the user. Analytics, if you really want to actually dig into the user behavior and the patterns they are accessing the information, you could always implement analytics. And the people involved, right? One of the mistakes that a lot of people do is try to take their web team, the graphic teams of the work, who have worked on the web application. They try to pull them up and try to put it in the mobile project right away, assuming it's going to work fine. And in most of the cases, it does not. You need to get somebody who has worked on the mobile applications and mobile UI in the past for getting better results. So that's on the usability. And the final one is the mobile device management, which is again very, very important. So if you're a large hospital institution, if you have hundreds of doctors and thousands of patients coming in, and you do not want to give, say, iPads to all your 1,000 different doctors, but you want to bring in the facility for them to use their own device, then there's a concept called BYD, bring your own device, which is the doctor has the ability to access the information on its own device, which also brings in the fact that means that you have to put a lot more security measures, because the device is not owned by the organization. Hence, you should allow the user to actually delete the information. You should allow the user to have their personal stuff as well, at the same time the corporate stuff, right? So you have to extend your ID policies to your mobile devices, and the way to do is basically go for an MDM tool, which is available in the market. There's a lot of them. I'll show you a quick view on that right after this. The MDM actually gives you an ability to wipe, lock, and notify data. So in case your mobile, one of the mobile from the doctors is stolen and you want to kind of lock the mobile before anybody could access it, or wipe off all the data which is available, you could do that right sitting in your desk. Secure data connection, all the information which is passed from the server to the mobile phone, all are encrypted, goes to the firewall, and you have role-based access. You can audit entire inventory of the devices you have by the profile management. You can activate, deactivate devices. You can monitor what are the applications which are getting installed. I mean, for instance, if you don't want your employees to actually install games like Angry Birds, provided you are providing the devices, you would actually put alerts for that. So if anybody installs it, you would come to know about it. You can track geolocations from where are people accessing more. It's within office or within or outside office or from their home. Time intervals which are there, which can actually give you a lot of analytics in terms of knowing, how the doctors are productive when they are not at office. You can have options like, avoiding access without Wi-Fi. So that means the doctor can access information only through within the premises through Wi-Fi, not outside. And there are different protocols like WEF, WPA. Those are the wired equivalent privacy protocols which are available. WPA2 Enterprise seems to be the strongest one. The authentication, you can have failed attempts. Anybody who fails more than 3 times, you essentially wipe off the data, and you can set a strong password patterns in the MDM, backups and patches which you can enforce. And now the MDMs is available on cloud as well. And here's a quick look on the tools which are available given by the Magic Quadrant of Gartner. Good technology is at the top. AirWatch is one of them which I personally like. And here's a quick view of the AirWatch application where you can see the number of phones on iPhone platform versus Android, number of active users, and stuff like that. So that's all I had on the 9 yards of taking your application to mobile. Varun?
Yeah, thanks a lot, Vinod, for the total inputs. And yeah, now is the question session, and we have hardly 5 minutes to go. So I'd like to take the first question from one of our audiences. How do I choose the mobile platform for my app?
Right. Essentially, if you're an ISV, you can do a quick survey on your users. I mean, I presume most of them would be physicians, so you can check with them in terms of having a survey, an online survey in terms of what devices they have. And if you get a majority out there, say 75% using iPad, then you could go for that. But if you get a fragmented output saying that 30% on BlackBerry, 30% on iPad, 30% on iPhone, then you probably think of an option on HTML5. But again, you need to think what level of device level features you need to have, what level of integration you want to have with external devices like glucometer. These are the parameters you keep in mind before deciding which platform you want to go for.
Okay. The second question is, what would be the list of suitable EHR features for mobile?
Okay, I'll take this. This is Finny. When you are evaluating how to move your EHR from web-based to a mobile-based, you need to consider a few things. One is, of course, you need to have a clear roadmap. You need to consider and you need to evaluate and find out what are the various modules or what are the various features you want to move to a mobile app. I mean, everything can be done in a mobile app, of course, in a tablet. But then, is it necessary for you, or is it, or are you just going to use the prescribing tool? Are you going to use only a radiology image viewing tool? So based on it, you really need to decide. And the way you move forward would be first try to build just a viewing app in your mobile, as in just build the patient viewing applications don't build any applications or don't build any functionalities which would allow you to do any transactions. Then you assess the behaviors again, and then start slowly implementing the transactions as well. Build prescription module in it where doctors can prescribe. Build a radiology module in it where doctors, radiology or a lab module where doctors can request. So to answer that question, what would be the list of suitable EHR features for mobile? You could ideally have almost everything in it, but then it's everything in mobile applications. But what's required is what is needed for you.
Right. To add to that, I mean, you can also check the most used features in your current application, maybe a client server or a web-based application. You can check the most used features, and secondly, what adds to the convenience of the physicians and patients.
Yep. Thanks, Vinny and Vinod. Yeah, since we don't have much time to go forward with the questions, I would like to recommend the attendees to shoot out an email to either Vinny or Vinod with your questions, if any. And thanks a lot for your participation for this webinar, and thanks again, Vinny and Vinod, for the wonderful webinar session. Thank you.
Thanks. Bye.
Thank you. Bye.
The organizer